I'd now like to invite my good friend and colleague, Professor Dame Anne Johnson, who's President of the Academy of Medical Sciences, to assume the chair and introduce Patrick Vallance. So, Anne.
Thank you, Andrew, and good morning, everybody. It's my great pleasure to welcome Patrick Vallance. I'm sure he's well known to all of you as Government Chief Scientific Advisor. He's been immensely involved, as you know, in the UK response and internationally, and has indeed led and chaired the National Core Studies. And it's been a great pleasure to work with him in that capacity, but even greater pleasure to welcome him today to talk to us about UK learnings from COVID and where now. He's going to speak to us for about 10 minutes, and then we're going to have time for 10 minutes for questions. So let me encourage you, as you did yesterday, I think, to put your questions into the Q&A session so that we can ask Patrick to answer them at the end of his time. Over to you, Patrick. Welcome.
Thanks very much. Good morning, everybody, and thanks, Andrew, for organising this, and Jeremy for such a good introduction. And like many of you, I was moved by the videos and the point that we must remember that this is individuals that we're talking about who've been deeply affected by the terrible situation over the past 18 months or so. I wanted to talk about science and the pandemic and how we've thought about that in the UK context. And I'll go back to January 2020, when we pulled together a group of funders and others to try to look at what needs to be done. And looking back at the notes from January the 27th, 2020, a number of things were agreed at the meeting. We needed a rapid call for proposals because we needed to move fast, particularly in areas like vaccines, therapeutics, diagnostics. We needed the regulators to be prepared to be agile and to move quickly when things emerged. We needed a system for getting samples from patients and to be able to share those across the research system. We needed the public health system to link with industry around diagnostics. We identified that messenger RNA vaccines were likely to be a critical way out of this, and that repurposing drugs and trialing those fast was going to be important. So that was a sort of scene-setting meeting that I think led to a number of actions, some of which have come good, not all of them came good, and have been a foundational thing for what happened next. So if you just fast forward a couple of months, there were a few things that became very obvious, and one of them was a complete lack of data. It was very difficult to get data out of the system and to use it to guide the management of the pandemic. So it was crucially important when two things happened. The first was that the ONS put together its surveillance study. That was an incredibly important part of us understanding how the pandemic worked. And the second is the flow of data from the NHS into various integrated systems, and particularly the formation of the Joint Biosecurity Centre, which was a big data analytics hub, which made a big difference in being able to monitor the epidemic. So those data-driven approaches and the ability to go out and do a survey were fundamental. And the third thing that happened around March is we formed the Vaccines Task Force, because there's a difference between knowing the science going on and knowing how you're going to pull it together and make a product. And clearly what was needed was the integrated ambition across science, engineering, product development, and so on to get vaccines into a position where they could be used. Fast forwarding again, as the pandemic progressed and we went through terrible situations with long lockdowns like many others in the world did, it became obvious that whilst there was a lot of science going on, it was quite difficult to pull out the science in relation to policy advice sometimes. And there were certain gaps that needed filling and certain aggregation of data that needed to occur in order to get this right. And that led to the concept of there being core areas that we needed to bring things together in, and hence the core studies, the national core studies. And the areas that you'll hear about later on, of course, included surveillance and epidemiology, built largely from the work that Ian Diamond had pulled together in the ONS. The second theme was clinical trials infrastructure. How could we make sure that the infrastructure for therapeutic and vaccine studies were adequate to deliver what was required? The third area was transmission and environment. And this is still a really difficult area. We don't really yet have a good handle on how this virus is transmitting, what the environmental factors are that allow it to transmit more, why we get outbreaks in certain places and why certain people get them. So the transmission and environment work stream was set up to try and answer practical policy questions that could have implications for what the government needed to do. The fourth area was immunity, an obvious one. But again, the need was to try and pull together the many, many different studies going on, looking at antibody levels, looking at different aspects of the immune response, getting some consistency across those so we could compare apples with apples rather than try and look across multiple diverse ways of measuring immune responses. The fifth was a recognition that longitudinal health was going to be an issue, and we needed to pull together one of the great strengths in the UK, actually, which is cohort studies and associated observational studies to really try and understand what the long-term health impacts of COVID were and what could be needed in terms of policy. And finally, and far from least, was the data and connectivity work stream, which Andrew Morris led. All of the above were clearly dependent on our ability to get good data flows, good data systems, good data access, interoperability, connectivity across data. It made a massive difference to the ability to understand what was going on and to think about the policy implications. So the very clear objective of the National Core Studies was not to start a whole load of new basic science work. There's lots of science work going on, but to make sure that we had a system to aggregate that, understand the results, understand where there were gaps, fill the gaps, and create answers that were relevant to policy questions. What are the outcomes of this that have been particularly important? Well, you'll hear the details, but I want to pull on some things that I think are relevant to thinking about the future. Team science was crucial. This was not a solo effort. This was a massive team effort. People came together quickly, worked well in teams. Interdisciplinarity was important. Everything from social science through to structural biology was important in every aspect of this. Coordination, oversight, and challenge was provided by both national and international groups. Data sharing, absolutely fundamental to the success of this. Expertise, the need to pull in people quickly who understood the depth of the science, and everyone on this call will understand that, but it's not always the case that you get expertise pulled in at the right level rapidly enough. It was a four nations approach in the UK. That was important. We were trying to tackle this as four nations. We needed to make sure we had appropriate coverage. And all of this meant that we ended up with a system where science could play rapidly into policy advice. That remains the case today and will remain important because, as Jeremy has said, this isn't over yet. And of course, it's certainly not over globally, where the need for vaccination across the world is critical. So that leads me on to my last point, which is, as part of the recent G7, two things were really highlighted to leaders. One was the need for an effective global surveillance system, as Jeremy has described. And the second was an ambition in any future pandemic to be out of the blocks really fast. Of course, with the basics. Healthcare system in a good state, public health system in a good state, PPE available, but specifically to go after vaccines, therapeutics, and diagnostics within 100 days of a pandemic being declared. And an international group came together to try and map out what that looks like and came up, I think, with a number of very clear suggestions based around three areas. Get the arsenal of molecules and vaccines against potential infectious threats ready in advance. So that requires a lot of R&D. Embed, as Jeremy has said, practice in normal everyday work. So clinical trial structures across the world, manufacturing that's used regularly and is distributed across the world so you can upscale it during a pandemic. And thirdly, define the rules of the road. So you're not negotiating finance or negotiating supply chains across borders in the middle of a pandemic or negotiating data sharing. Those things become important because speed is crucial in the time of a pandemic. And many of the things that the national core studies have done have really allowed those sorts of thoughts around how to prepare for the next pandemic to be science-based and to be about utilizing what you have in a country in order to pull efforts together and to do so in a coordinated and focused way. So I thank everybody who's been involved in this. It's been absolutely brilliant, and you'll hear later on the details of what's come out of these crucial studies. Thanks. And with that, Anne, I'll hand back to you.
Okay. Thank you very much, Patrick. That was a tour de force of so much that has been achieved, so many challenges in the last year and a half, and so much progress being made. And then, as you pointed out, so much more to do. There's a number of questions coming in, and one to start with that directly addresses the issues you've raised about data and data access. So this is an anonymous question, but data hesitancy, that is data sharing and data access, seems to continue to be a significant barrier to research and innovation. How do we create the ecosystem and infrastructure that ensures trust and incentivizes this to be happening much more readily? So what do you feel we've learned moving forward from this big effort to harmonize data?
Well, it's a great question, and it's a sort of perennial one in a way, which is this question of trust. One of the things that's happened during the last 18 months is the obvious use of data has been clear so that people can see why data matters. That's an important part of the trust story. I think it's quite an abstract concept for many people as to why data helps improve healthcare. That's not abstract now. It's very clear how this has been used. So telling a good story around data use and why it matters for health of individuals, health of populations, and the way healthcare systems run, I think can be done more easily as a result of what's happened over the past year. The second point is it is a legitimate concern around privacy. It's not something to be brushed aside. It's a very real thing. And so trusted data access and the ability to do that in a way that assures privacy is crucial. And I think a lot's been shown during this pandemic as to how that can be done. And I think there is a change in the debate, actually. I think there is, although there is still quite a resistance in some places, you can begin to see a narrative emerging, particularly in the press, that now understands why this business of data access is not about sort of misusing data, ripping data off for some nefarious purpose. It's actually a fundamental way in which healthcare systems are going to have to work in the future.
Thanks very much, Patrick. So now a couple of questions, a number of questions have come in about vaccines. It's something that Jeremy addressed, but you also addressed it in terms of the pandemic preparedness plan. So one question from Kathy Sudlow, who said that what can we do to ensure that countries like Brazil, who've made a massive contribution to vaccine trials, and India, who are doing a major role in manufacture, receive the vaccine supplies and support for rollout that they so badly need? And a second question, anonymous question, is touching on the same topic. Should we be focusing on allowing developing countries to manufacture their own vaccines so we don't allow new variants to develop? So lots of questions about how we achieve the ambition for vaccine equity that's been discussed by Jeremy and others.
Can I sort of slightly do that in reverse order by saying about the future? Absolutely. And so the 100-day mission that we put together was very much about trying to get this working in a way that was equitable and globally accessible fast. That means accessing finance quickly. It took far too long to get money out of the door into systems like COVAX, far too long. And that meant there were big delays in getting procurement into countries across the world. So that should be possible to sort out now. So next time you can activate balance sheets from World Bank and so on quickly. It should be possible to get manufacturing set up much more distributed than it is today, but you've got to do that now for the future. And you've got to use those, for example, for an on-vaccination campaign. So the manufacturing facilities are there and used. It's not easy to do tech transfer of manufacturing complex vaccines in the middle of a pandemic. And I think the answer, I'm afraid, for now is not to suddenly get a whole load of things trying to be set up in countries all over the world. That's going to be incredibly difficult. It's to ramp up the manufacturing we've got, and I think lots of that's happening, and for politicians to agree a process for equitable access, distribution, and deployment. This is primarily a political question that needs to be addressed now. And one of the challenges across all of the vaccine space is everybody can think of new uses for vaccines and who they'd like to get it. In a supply constrained environment, the question you need to address is who do you not want to give it to if you're going to do that? And that is the political question that is currently the one that politicians need to grapple with and be straightforward about. Going forward, as I say, I think there are ways in which this can be done. And just to be clear, for vaccines, very often the limitation is not so much IP as tech transfer. It's a really complicated process. The tech transfer needs to be in place, which is why our recommendations are get distributed manufacturing networks set up and use them regularly. Then they can be scaled during the pandemic.
Thanks, Patrick. And we've got a great optimistic question here. Although the pandemic has been detrimental to so many, what do you think the main benefits have been for clinical developments in the UK?
Well, I mean, what's amazing is how quickly things have been done. I mean, it's at the beginning of this, and I referred to the meeting we had on the 27th of January, 2020. I don't think any of us thought we'd have a vaccine as quickly as we got one. I mean, it just was not possible. People had looked at vaccine development. Vaccines often take a decade. Sometimes you never get one. We still haven't got one for HIV. Malaria, still struggling to get one that's really effective. You know, it just seemed inconceivable that we'd be able to do it so quickly, but we knew we had to try. So it tells you with real focus and real energy, you can achieve pretty remarkable things. We've seen amazing examples of team working. We've seen an amazing understanding in government that data and science are crucial to decision making. These are really positive things that need to be bottled. And my biggest fear is that we have a flurry of excitement around it now and then everybody forgets. So I think the challenge we've all got is how do we embed this in ways of working going forward? How do we not slip back into old ways of working? And for governments, there is an opportunity here to define what are the big things that you would like science and technology to help deliver against. So net zero, obviously health things and future pandemics, and how can we marshal our efforts to be in a position to deliver those, and not just deliver, but to innovate at all times.
Thanks very much. And Patrick, I'm very aware you've got to leave us in about 1 minute. So here's one last question. What gaps are there in our current understanding of the environmental factors relevant to transmission? What are studies currently focusing on?
Well, there's an awful lot, and Andrew Curran, I think, is speaking later about the Environment Transmission Group, and he should speak about that. I mean, there's a lot we don't know. I mean, we know that the routes of transmission include touch to face. We know that they include droplets over 2 meters. We know that there's an aerosol component over for longer transmission. What we do not know is the relative proportions of those in different environments. And so, you know, all three are being looked at, appropriate to do so, but we don't really know what are the factors that make it more likely. We know indoors is much worse than outdoors, but we don't within that have really good handles on how much worse. You know, we see stories of quite distant aerosol transmission, airborne transmission in hotels, in quarantine hotels. People have looked obviously at wastewater and looked at distribution there. So I think there's, we're still, I'm afraid, at the foothills on some of the factors on transmission. We don't know what the effective dose is. We don't know how the effective dose alters the pattern of disease with any degree of accuracy. So there are many more questions still to be answered, which range from looking at environmental studies through to, for example, the importance of human challenge studies to try and answer questions about dose and duration and relative stages at which you can impact the course of the disease.
Well, thank you very much indeed, Patrick. I'm sure later this morning at the 10 o'clock session, we'll be hearing then from Andrew. We'll be able to unpack more of the issues that you've just raised there. Thank you so much for a really fantastic overview and also for answering so many questions. We mustn't keep you any longer, but look forward very much to continuing to see the work of the core studies develop. Thank you very much for all your leadership.
No, thank you, and thanks to everybody else. And you believe me, I wish that I could spend the day listening to this symposium, because that's going to be great, and the work has been really important and stimulating. Thank you.